Assalamu alaikum, dear viewers and residents. This is Dr. Sujan Sharif, Assistant Professor of Neurosurgery. We are demonstrating a case of 55 years old women presented with right P2-P3 junction aneurysm. This is a very rare case of aneurysm what we have operated. This is the image. You can well appreciate this is the basilar artery, basilar top, and this is the P1, and this is the P2, and this is the P2-P3 junction, and the aneurysm is a bit fusiform, and the dome is very big, and it's directed towards medially and anteriorly, and this is the distal part of the P3 P4, and this is the proximal segment. Here we can well appreciate the aneurysm neck and dome. And now we can see in this image the aneurysm dome is directed towards medially and the proximal segment is on the laterally. So we will find subtemporal approach. First of all, we find the dome, and then we will dissect the proximal P2 segment of the posterior artery. This is the sagittal section, and this is the coronal section. We are planning to do a subtemporal approach, identify the tentorial margin, fourth nerve, third nerve, and proximal P2 segment of posterior artery. And this is our incision line for a true temporal craniotomy. This is the durotomy, which is a horseshoe pattern and directed towards inferiorly at the petrous part. Now we can well appreciate the tentorial margin through this subtemporal approach and this crural cistern, ambient cistern. And now we can well appreciate the fourth nerve. This is the fourth nerve. See, the fourth nerve is meticulously dissected. And arachnoid dissection is going on. With the course of the fourth nerve, we will identify the P2 segment. This is the P2 segment of the aneurysm, and you see the dome of the aneurysm lies medially, a bit medially, and this is the distal segment, and this is the dome of the aneurysm, and this is the neck of the aneurysm. Now we are dissecting neck of the aneurysm. Very meticulously dissect around the neck, and the wall is a bit thick, and it was helpful for us to dissect the whole of the aneurysm wall in 360-degree fashion, so that we can well identify the proximal vessel, perforators, and this is the deeper part of the aneurysmal dome, and this is a blade. You can well appreciate this is a blade which is also directed towards laterally. Now this is the permanent clip on the blade first, as it's the deeper part. And then we dissect it from the medial part, that is the midbrain, and then we dissect it from the distal segment of the P3. Now we applied the permanent clip on the superficial dome and the dome which is directed towards medially, and now we are removing the temporary clip, and this is the final view after applying two clip, and this is the tent margin, and this is the hemostasis. Very minimum handling, well delineation of the aneurysmal wall and perforators were performed. And this is the postoperative view. There is no hematoma, no ischemia, no vasospasm, and the neck of the aneurysm was clipped very appropriately. Thank you for patience watching.